everyone, so let's move towards our today's topic, which is
nose. Okay, and I can also say that it's my favorite topic because I think it's easy as well as it is very important as well. But to be very honest, it's very easy topic. Okay, now nose. What is nose? Nose is the organ which is present. Obviously you can easily see it from the interior side of the skull, interior side of the face, and it is basically it helps in olfaction, which means smell, and as well as it helps in respiration also. ऑब्वियसली आपको पता है हम नाक से सांस भी ले सकते हैं, और अगर हमें कोई खुशबू या बदबू अगर हम सूंघते हैं तो वो थ्रू नोज़ यानी नाक से ही सूंघते हैं. नाउ ऑल्फैक्शन, अगर मैं थोड़ी हिस्टोलॉजी आपको बता दूँ जो कि आप पहले भी पढ़ चुके हैं, दैट इज़ कि जो रूफ़ ऑफ द नेज़ल कैविटी है, नोज़ है, इट इज़ कवर्ड बाय सूडो स्ट्रेटिफाइड कॉलमनर एपिथेलियल सेल्स on which olfactory cells are present which helps in olfaction. जहाँ से स्मेल का प्रोसेस होता है, सेंस ऑफ स्मेल, यानी आप सूंघने की आपके अंदर जो एबिलिटी है वो थ्रू olfactory सेल्स होती है, olfactory नर्व के थ्रू और एंड सो ऑन. अगर मैं बात करूँ रिमेनिंग पार्ट ऑफ द नेज़ल कैविटी की, तो इट इज़ कवर्ड बाय रेस्पिरेटरी mucosa. Okay, and respiratory mucosa is like which helps in respiration. That means कि जो inhaled air है, inspired air है, वो warm हो जाती है, वो साथ ही साथ clean हो जाती है, filter हो जाती है. Now अगर मैं बात करूँ anterior to posterior nasal cavity के अंदर, anterior to posterior अगर हम जा रहे हैं तो हम देखेंगे कि वहाँ पर नोज़ में 3 पार्ट्स बन गए हैं, 3 पार्टीशन हो गए. एंड यू कैन ऑल्सो सी दैट पार्टीशन इन द इजी मेडिकल बुक वॉल्यूम 2 एज वेल, दैट दोज पार्टीशंस आर कॉल्ड एज द एंटीरियर पार्ट, एंड द एंटीरियर पार्टीशन विच इज़ द स्मॉलेस्ट एंड द शॉर्टेस्ट पार्टीशन, दैट पार्टीशन इज़ कॉल्ड एज वेस्टिब्यूल. Okay, in which the hairs are present, and those hairs are called as vibrissae, and those hairs are basically helps in to filter the air and to warm the air as well. So basically the vibrissae part, the part where the hairs are present, that part is called as vestibule. Then after vestibule, the posterior part to the vestibule or the middle part of the nasal cavity is called as atrium. Okay, and the posterior part, which is also the longest part or the largest part, it is that part is called as conchae. Okay, conchae, and that part we will discuss in after few minutes. But first you have to remember that these are the 3 parts of the nasal cavity. Now if I told you that if I can tell you about the structure of the nose, how the nose is formed, not the development, but the bones which are involved in the nose. So before starting that, I would like to tell you that bone is basically made up of is partially made up of bone, as well as it also nose is also formed by cartilage as well. Now the cartilages which are involved in the nose, which are forming the nose, are the lateral cartilage, alar cartilage, and the septal cartilage. Okay, septal cartilage is basically the nasal septum, which we will discuss after this topic. But if I talk about bones which are involved in the nose, so that is basically like the major bones which are involved in this structure are the maxilla, the frontal bone, and the nasal bone. But nasal bone, maxilla और frontal bone के अलावा की अगर बात करूँ तो palatine bone भी होती है, साथ ही साथ sphenoid bone भी होती है थोड़ी बहुत, और sphenoid bone तो नहीं लेकिन frontal sphenoid bone and ethmoid bone ये इन्वॉल्व होती हैं. और ethmoid bone भी आपको मैं आगे चल के बताऊँगा कि इथमॉइड बोन होती क्या है, किस तरह इन्वॉल्व होती है. नाउ इफ़ यू सी द नोज़ फ्रॉम द लेटरल व्यू, ओके, लेटरल व्यू से आपने अगर नोज़ को देखा और अगर सजाइटल प्लेन में से आप उसको डाइसेक्ट कर दिया और आपने लेटरल साइड से नोज़ को देखा, so you will easily see the borders of the nose. Now what are the borders? Anterior border, superior border, inferior border and the posterior border. The inferior border is the floor of the nasal cavity. The anterior border is basically the vibrissae part, vibrissae area. The superior border is basically the area which is formed by frontal bone. Okay, and the posterior border yes, the posterior border. The posterior border is basically formed by the ethmoidal bone. Now the superior border, okay, one more point, the superior border is also formed by nasal bone as well. Now if I have talked like the roof, okay, so basically the roof of the nasal cavity, if you see the diagram in the Easy Medical Book volume 2, you will see that the nose is basically it is like slope shape. Okay, पूरा ऊपर का एरिया जो है जहाँ पर पार्टीशंस भी दिखाए हुए हैं मैंने, प्लस नोज़ बाहर एक स्लोप भी आ रहा है, फिर स्लोप कंटिन्यू हो रहा है. पोस्टीरियरली अगर हम देखें, एंटीरियर टू पोस्टीरियरली अगर हम देखें तो पहले स्लोप है, देन पोस्टीरियरली एक स्ट्रेट लाइन है, हॉरिजॉन्टल लाइन है. सो ये पूरा का पूरा रूफ है. ओके, नाउ दैट रूफ is basically formed by nasal bone and frontal bone. Okay, and if we talk about floor of the nasal cavity, so you can easily see that there is a maxilla bone which I have also drawn in the diagram in the Easy Medical Book volume 2. So the maxilla bone is basically forming the nose. Okay, now this is basically the overview or the introduction of the nose. Now we will move towards the nasal septum, lateral wall and concha and further more topics, but in the next part of this lecture. So till then, work hard, study hard and good luck. Thank you. Bye.